Hi, my name is Monica Gluns. I'm a junior nursing student at Bloomsburg University, and today I'm going to talk about the global health problem that is the Zika virus. So, what is the Zika virus? The Zika virus is spread to people primarily through the bite of an infected Aedes species mosquito. Many people infected with the Zika virus won't have symptoms or will only have mild symptoms. And the Zika virus infection during pregnancy can cause microcephaly and other birth defects. So I have a picture here at the bottom. On the left, you can see a baby with a normal head size, and then in the middle, a baby with microcephaly, and then on the right, a baby with severe microcephaly. So it's basically the shrinking of the head, which is a birth defect that can be a side effect of the Zika virus. So where is Zika found? Zika was first discovered in a monkey in the Zika forest of Uganda in 1947. Before 2007, at least 14 human cases of Zika had been documented, although other cases were likely to have occurred and not reported. Zika outbreaks have probably occurred in many locations, but because the symptoms are similar to those of many other diseases, the many cases have not been recognized. And since May 2015, the CDC has been responding to increased reports of the Zika and has assisted in investigations with PAHO and other country ministries of health. The first travel notice for Zika in Brazil was posted in June of 2015. On January 22, 2016, the CDC activated its Emergency Operations Center to respond to outbreaks of Zika occurring in the Americas and increased reports of birth defects and Guillain-Barré syndrome in areas affected by Zika. On February 1st, the WHO declared a public health emergency of international concern because of the clusters of microcephaly and other neurological disorders in some areas affected by Zika. And then on February 8th, 2016, the CDC elevated its EOC activation to a level 1, which is the highest level. So, preventing Zika, this is the first step that you want to think about. So if you want to prevent Zika, you first want to plan your travel accordingly. You want to watch out for travel advisories. If you're pregnant or planning to become pregnant, the CDC advises you not to travel to places where the Zika virus is found because it can put you at an increased risk, especially for the birth defects found from the virus. So also you want to protect your home. You want to keep screens and windows and doors and repair holes in old screens. Use air conditioning if available and do not open the windows. If air conditioning is not available, it is advised that you sleep under a mosquito net. And check outside your home for places that can hold standing water and empty these reservoirs and scrub them once a week. These are things like pots and bird baths and just different places that can hold water because the mosquitoes like to lay their eggs near standing water. So this kind of disrupts their life cycle if they can't lay their eggs. Lastly, you want to protect yourself, so you want to dress in long sleeves and pants that cover your skin and use insect repellents if you're in an area affected by the Zika virus. If you have a child, cover cribs and strollers with mosquito netting. And as I've said before, if you have to sleep in an area where you have to have the windows open, put a mosquito net over your bed. And last, practice safe sex, especially if there's a chance that you or your partner may have the Zika virus because it can be sexually transmitted. So how do you get the Zika virus? You can get it from mosquito bites, a pregnant woman through her fetus, sex with an infected person, or laboratory exposure. There's no current evidence to suggest that Zika can be spread through touching, coughing, or sneezing, which is good. And as of November 10th of 2016, there have been 4,255 cases of Zika in the United States and the District of Columbia, and 32,068 cases in the U.S. territories, including Puerto Rico, American Samoa, and the U.S. Virgin Islands. And the picture above, the gray is areas that have no cases of Zika, and then the light blue going to the dark blue. The lightest blue is the least amount of cases, and the darker it goes, the more cases there have been. So in Pennsylvania, you can see that we are dark blue, so we're greater than 101 cases, which is kind of freaky because you don't really hear about it that much. You don't really think about it that much, and we're not a tropical area, but we still have people who've been exposed. And then you can see Puerto Rico and the U.S. Virgin Islands on the right, and then on the left, American Samoa, with stripes through them indicating widespread exposure of the virus. So, symptoms of the Zika virus. The most common symptoms are fever, rash, joint pain, and conjunctivitis, which is red eyes. Symptoms of Zika are similar to other illnesses like the dengue fever and chikungunya, which are also spread through mosquito bites. And many people who have Zika will not have symptoms and will only have mild symptoms, which is why before there weren't many cases that were reported because this disease looks like other diseases. And people don't usually get sick enough from the Zika to actually go to the hospital. But if you've been to somewhere that is exposed to the Zika virus and you have any of these symptoms, it's advised that you seek health care immediately. So, testing. When do you want to get tested? If you've been to an area affected by Zika and you have symptoms of the virus mentioned before, if you've had unprotected sex with someone who's been to an area affected by Zika and have symptoms of the virus, and all pregnant women who have been to an area affected by Zika and have had unprotected sex or have had unprotected sex with someone who has been in these areas. Diagnosis. To be diagnosed with Zika, the doctor will ask you about any recent travel and signs and symptoms, and then a blood or urine test can confirm the Zika infection. They'll also test you for other viruses such as dengue or chikungunya to rule out a diagnosis of these because the symptomology is similar. And a pregnant woman with possible exposure to Zika virus from sex should be tested even if she doesn't have the symptoms. And it's not recommended that asymptomatic men, children, or women who are not pregnant should get tested for Zika, so no need to worry if you fall into one of those groups. So unfortunately, there is no specific treatment for Zika yet, but if you get diagnosed, you want to treat the symptoms, so get plenty of rest, drink fluids to prevent dehydration, take medicines such as Tylenol to reduce fever and pain, do not take aspirin or any anti-inflammatories until dengue can be ruled out because these can cause more bleeding. And if you're taking medicine for any other medical condition, you want to talk to your healthcare provider before you take anything additional. So this stuff is kind of like you just want to treat the symptoms, kind of like you have the flu, just rest, stay hydrated, and control your pain. So some updates. In February 2016, the WHO named Zika a worldwide health emergency. And as of November 18, 2016, the WHO has officially stated that Zika is no longer a world health emergency, but there's still a risk that's not at a level of an international health emergency. By lifting the worldwide health emergency status, the WHO is declaring the virus is here to stay, so it's still important to follow the precautions that's mentioned before. So some resolutions that people are talking about. One of them that I found interesting is this mosquito army. So scientists are planning to release an army of millions of modified mosquitoes in areas of Brazil and Colombia. These mosquitoes are infected with a bug called Wolbachia, who reduces their ability to spread the virus to people. The bug doesn't usually affect the mosquito that carries the Zika virus, but scientists have found a way to inject the bug into these mosquitoes. In lab tests, the bug is shown to stop the spread of dengue and is thought to do the same for the Zika virus as well. This program is projected to start in early 2017 and will be monitored for years after to see if the cases of dengue, Zika, and chikungunya fall, which will be really interesting because this is a good way to just modify what you already have instead of making a big deal about it. So next, what you probably already thought they were going to have is a vaccine. So all over the world, scientists are racing to make a vaccine against the Zika virus. This process usually takes around a decade, but due to scientific advances and all that stuff, researchers predict a vaccine could be available by 2018, only 2 years after they began to synthesize one. So, in September 2018, President Obama approved a $1.1 billion spending package to fight the virus, and about $400 million of the money will go towards developing a vaccine and diagnostic test. Most scientists in the race feel like they'll be able to create a vaccine, so that's a good sign. And dozens of people worldwide have already been injected with possible Zika vaccines and are starting to be monitored for 2 years to monitor their effectiveness. So these are my references, and thanks for watching, and keep calm and repel mosquitoes, and remember all your precautions if you're traveling to somewhere with the Zika virus, especially if you're pregnant or you're going to become pregnant. Thank you.